The childbirth experience has really evolved in many ways during my time at the Brigham. I have been here for 30 years, and one of the most important things is the number of options have changed. For example, the type of pain relief services that we offer. It used to be years ago that many women who did not want an epidural or medical type pain relief were pretty much restricted to some of the heavy breathing techniques, like we sometimes call the Lamaze techniques. It's now recognized that those really don't provide very adequate pain relief, but for women who don't want medical pharmacologic pain relief, the number of options are now hugely different other than just heavy breathing techniques. In addition, we now offer a variety of medical techniques, and that includes narcotics. It used to be years ago, if you got an injection of a narcotic, it was pretty much a very heavy dose where the woman became very sleepy, very drowsy, often with some associated side effects, both to mother and baby, whereas now we have options, primarily patient-controlled options, where patients can control their own dose of medications, and that goes not only for narcotics, but for the epidural type anesthetic, which we use for roughly 75% of the women having birth at Brigham and Women's, and that's pretty similar to the national averages for use of epidural anesthesia during childbirth. We also offer the use of non-pharmacologic pain relief, such as hydrotherapy or immersion in a water tub, birth balls, which are like these big exercise balls that you can bounce around on and many women find to be very soothing and relaxing or distracting during labor. Just getting up and walking, for example, ambulation seems to be helpful. Mental imagery techniques or focusing, or sometimes called hypnotic techniques during labor. And of course, the adjuvant use of doulas is very helpful. Doulas are labor support personnel who can help reassure and encourage you and coach you during labor. And one of the most important things about all of these non-medical techniques is that they're very compatible with the use of epidural anesthesia. So for example, you can try your mental imagery or focusing hypnotic techniques and still use an epidural anesthetic. You can have the assistance of a doula and still use an epidural anesthetic, something I call the epidoula. So everything is all compatible. So we have led many innovations in different drug combinations. For example, the epidurals are not just one drug, but various combinations of drugs. And much of the research that we did over 20 years ago in say the mid-1990s looked at different combinations of drugs used for the epidurals, as well as for the spinal anesthetics, different methods of administration, particularly the advent of a patient-controlled epidural, where the patient can control themselves how much they get. And this is very important because many women experience different degrees of pain during childbirth, during labor. And having the ability to control that adds a great deal of flexibility. So we were one of the hospitals that developed some of the new regimens and techniques for patient-controlled epidural anesthesia. Another type of pain relief option that's a bit of a wrinkle on the epidural technique is something called combined spinal epidural anesthesia, where both a spinal and an epidural injection is done. And this has become very popular, allows an additional degree of flexibility, and many of the early studies on spinal epidural anesthesia were done here at Brigham and Women's. In the event that a cesarean delivery is required, the epidural can also be used for that by giving some additional dose of a stronger type of pain medication to allow her to have the cesarean delivery using the epidural anesthetic. Sometime within the next few months or maybe a year, we'll be offering nitrous oxide here at Brigham and Women's for pain relief options. The family-centered or family-focused cesarean, or sometimes called the gentle cesarean, is really an attempt to bring some of the concepts of natural childbirth or vaginal delivery to what is ultimately really a very medical surgical procedure, a cesarean delivery. So for example, we try to keep the room as quiet as possible without a lot of extraneous noisy conversations, really focusing on the mother and her partner, letting them use music if they would like to bring their own music, or we have music players available in our cesarean operating rooms. They can choose a selection of music. We advocate early skin-to-skin contact of the baby and the mother or the partner, and there's been a lot of evidence on early skin-to-skin contact showing that the babies will feed better, will bond better with the parents, will have better thermoregulation. In other words, they maintain their temperature. Babies tend to get very cool very quickly after delivery, but if they're maintaining skin contact with the parents, then this may help them maintain their temperatures. Infants of diabetic mothers tend to maintain their sugars better with early skin-to-skin contact. And then we also advocate for early breastfeeding. In some cases, even breastfeeding in the operating room while the cesarean delivery is still being concluded. The gentle cesarean or family-centered cesarean also allows the parents the option to watch the delivery. One thing that we do at Brigham and Women's, which is fairly unique for this hospital, is we have surgical drapes which are clear. In other words, allowing the parents to actually watch the delivery of the baby, which is something almost unheard of in any other surgical procedure. We, of course, always use a type of regional anesthesia, spinal or epidural, so the mother is totally wide awake. They don't get any sedatives. They're completely awake. The partner is with them. In some cases, we will even allow a second support person, such as a doula. Some people bring doulas in for cesarean deliveries. We allow them to come in, or in some cases, another family member may be desired. So we generally allow this. Probably the single most important thing when I advise women about preparing themselves for labor is to keep an open mind. Remember that labor is unpredictable. One thing that I often say is that one of the most predictable things about labor is that it's unpredictable. So keep an open mind. Don't be too rigid in your choices. Many women will prepare a birth plan with a list of options for what they would like during labor, and I encourage this. I think we all encourage this, but we also encourage these birth plans to be realistic and to be open and flexible.